Welcome back to DXB Today. Tonight we are talking all things World Government Summit and specifically in the healthcare sector. And our next guest is spearheading women's health in the region and using AI-driven diagnostics to improve early detection as well. With us right now, please join us in welcoming Sophie Smith from Nabta. Sophie, thank you so much for being on the show.
Thank you for having me.
So what would you say is the main thing that's being overlooked when it comes to women's healthcare specifically?
A better question might be what isn't being overlooked when it comes to women's health. We know that because women were excluded from clinical trials until 1993, there exists systemic gender biases in healthcare today. For example, it takes 4 times longer on average to diagnose women with the same chronic conditions as men, even though they're twice as likely to see a doctor in the first place, and only 4% of the global budget for research goes to women's health. So there's a lot to be done.
Wow.
And Sophie, you know, Nabta Health, we're no strangers to it here. It's doing amazing work in the field of FemTech. Looking at, you know, Arab Health and AI Everything and now the World Government Summit, what are the key trends happening in FemTech at the moment?
So I think there is a recognition now that there are gaps in women's health and there's a need to bridge them. All of the conversations that we were having at Arab Health were revolved around the topic of whether the GCC and the UAE specifically could become global hubs of innovation in women's health in the next 5 to 10 years, and what that would mean. It means a number of different things. It means putting a certain budget into healthcare research every year, approximately $500 million to $1 billion. It means having at least 3 women's health technology unicorns, so companies valued at over $1 billion US. It means at least 10 kind of global leaders in the medtech space in women's health, and it means increased numbers of researchers, approximately 1,000 across the region, who are participating in 200+ clinical trials every year. At the moment, there isn't really a global leader in women's health. There's a lot of work that is happening in fragmented ways, predominantly in the US, Europe, and in places like Japan. So there's an opportunity for us here to accelerate all of the innovation in women's health, including things like the applications of AI and other technologies.
Sophie, we cannot talk about women's health and not discuss maternity and the reproductive health of a woman. With, you know, the way things are in today's day and age, women are choosing to have children and start a family much later in life, and Nabta focuses heavily on maternal and reproductive health. What would you say are some of the common misconceptions when it comes to fertility and pregnancy care? Because, I mean, the old adage that you need to have kids in your late 20s or early 30s doesn't exist, because I've got friends of mine who are 41, 42 and popping kids left, right and center. At the same time, I've got other friends who are in their mid 30s and still struggling.
Yeah, so the global trends in fertility are very interesting. I think something that historically has been overlooked globally is the male fertility factor. Approximately 40 to 45% of infertility cases are male only, 30 to 5% are female only, and the rest are a combination of the two. And if you look at sort of trends such as the global sperm count, most of the things that affect a couple's fertility are oriented in the male. So the global sperm count has dropped by 50% in the past 30 years. It's trending to 0 by 2040. And if you couple this with other factors such as environmental pollution, exposure to endocrine disruptors, so things that throw your hormones off balance, Frost & Sullivan actually estimates that by 2032, 97% of couples in emerging markets, including places like the Middle East and Africa, will struggle to conceive naturally. So I think as technology advances, whether you start trying to conceive in your early 20s or early 30s or early 40s will become less relevant, but fertility factors, male and female overall, will become more important to think about because of outside factors such as the environment.
So Sophie, if you had to predict one major shift that is going to be happening in women's healthcare in the next 5 to 10 years, what would you say that will be?
I'm going to say something out loud in the hope that it then becomes true. If I had to predict one major shift, it would be that women's health becomes more of a priority. At Davos this year, McKinsey published with the World Economic Forum a report that highlighted women's health as one of the key opportunities for investment globally, along with things such as space and energy. So globally, there's a recognition that we've missed a trick historically. You know, women account for 50% of the global population and still only make up a tiny percent of clinical trial participants. 70 to 80% of all animal studies involve only male test subjects because women are deemed to be hormonally complex and our hormones might throw off the results of a study. But what that means is that most of the things that we have from our medicine, our therapeutics, even like medical devices, care plans for specific diseases are not designed for or tested on women. So if I had to predict one trend in the next 5 to 10 years, it would be that women's health becomes a global priority.
I definitely
Absolutely. And I mean, let's talk about Nabta. I want to know how you're using AI-driven technologies in order to help your vision come true.
Okay, so this is a very interesting topic. Our entire model actually relies and always has done almost exclusively on AI to be able to function. If you look at traditional healthcare, it has been designed and built to treat acute diseases. Things like infectious diseases, respiratory diseases. You have all of these specialists who are experts in an area of the body and associated diseases. When you go in to see a doctor, they pin you to a disease and to a specialist. The specialist treats the disease and in theory it goes away and so do you. And this works very well for acute diseases, but it doesn't work so well for chronic diseases. Things like diabetes, hypertension, high blood pressure, kidney disease in women, polycystic ovary syndrome, endometriosis, etc. With chronic diseases, unless you address the underlying factors of the disease, usually it stays. And so the way that our model works at Nabta is we use a combination of the clinician, the person or the patient, and an artificial intelligence, we call it an augmented intelligence, to take all of this knowledge that historically resided within specialties relating to specific diseases to analyze the billions of data points associated with these things and to reorient them and our recommendations around each individual person, their age, their stage, their goals. Rachel earlier mentioned personalized and precision medicine. This is essentially how it works. You take things that historically would have been too much by way of information and analysis to be held in one single person, and you use machines to apply them to every individual person.
It's fascinating.
Very much so. Well, Sophie, I've got to say thank you so much for joining us.
Thank you for having
You've
me.
touched on some incredible subjects there that I know that we could probably delve into for much, much longer.